Is your shoulder pain holding you back? Do you struggle to lift your arm, feel weakness, or even experience pain while sleeping? If so, you might have a rotator cuff injury. But how do you know for sure? Today, I'll walk you through exactly what happens when you visit your doctor for a rotator cuff diagnosis. Step by step. Whether you're an athlete, have a very physical job, or just dealing with wear and tear, this guide will help you prepare for your appointment and understand the tests doctors use to diagnose your condition. Hello, I'm Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, regenerative medicine, and rheumatology. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. If you're new here, make sure to subscribe and hit the notification bell so you never miss expert advice on pain relief and injury recovery. The rotator cuff is a group of 4 muscles and tendons that keep your shoulder stable and allow movement. Injuries here are extremely common, especially in athletes, active individuals, and even people who do repetitive overhead movements like painting or lifting. A correct diagnosis is the first step towards effective treatment. Without it, you might waste time on the wrong rehab plan, or worse, allow the injury to worsen. So let's dive into what happens when you visit your doctor for a rotator cuff diagnosis, from symptoms and physical exams to imaging like ultrasound and MRI. Before seeing a doctor, it's helpful to recognize the key symptoms of a rotator cuff injury. Common signs include persistent shoulder pain, especially at night or when lifting your arm, weakness, difficulty lifting objects or performing overhead activities, a clicking or popping sound when moving your shoulder can also be present, limited range of motion, struggling to reach behind your back or over your head. Pain that worsens at night is particularly characteristic of a rotator cuff issue as well. If these symptoms sound familiar, it's time to see a doctor. Here's what you should expect from your doctor's visit. During your visit, I'll start with a detailed history. Be ready to answer these questions. When did the pain start? Was there a specific injury or did it develop over time? What makes it worse? Does it hurt more during exercise or rest? Any past injuries? Previous shoulder issues could be relevant. How does it affect your daily life? Struggling with simple tasks like dressing, lifting, or driving? Your answers here help narrow down whether it's a strain, tendinitis, or a partial or full tear. Next comes a physical exam. The physical exam helps pinpoint the exact cause of your pain. Here are some key tests we perform. The drop arm test. You'll raise your arm and slowly lower it. If it drops suddenly, this suggests a tear. The empty can test. Holding your arm to the side like you're pouring from a can. Pain here may indicate a supraspinatus tendon issue. The Hawkins-Kennedy test. We check for impingement syndrome by rotating your arm internally. External rotation resistance test. Test your infraspinatus muscle for weakness. These tests help us determine if your rotator cuff is inflamed or injured. Next comes imaging. Do you need an X-ray, ultrasound, or MRI? If we suspect a rotator cuff injury, imaging can confirm the diagnosis. Here's what we will use. X-rays are frequently done first line. They can rule out arthritis or an acute bone injury. Not very helpful for looking at the rotator cuff though. Ultrasound. This is fast, non-invasive, and done in the office. This lets us see tears and inflammation in real time. Then there's MRI. Provides a detailed view of soft tissue issues and can confirm full thickness tears as well as evaluate the labrum and bone as well. Most of the time, diagnostic musculoskeletal ultrasound is enough for diagnosis of rotator cuff injury, thus saving time and cost. Caveat here is that your physician in their office needs to be skilled in doing ultrasound to help you out in this regard. Next, let's discuss some common misconceptions and frequently asked questions. Does pain mean that you have a full thickness tear? Nope. Even minor injuries can cause pain in the shoulder. Are all rotator cuff injuries, do they all need surgery? No. Most recover with physical therapy and regenerative medicine. Do we need MRIs always to make this diagnosis? No. Often ultrasound and a good physical exam are enough. Now some frequently asked questions. Can I move my arm if I have a tear? Yes. Many partial tears allow movement but cause pain and weakness. How long does diagnosis take? If you're coming in as a new appointment, you're speaking with a physician, getting a physical exam, and getting an ultrasound, that can generally all be done within about 45 minutes with immediate results with the ultrasound being done at that time. So diagnosing a rotator cuff injury involves reviewing your symptoms and history, a hands-on physical examination, and imaging. Frequently, ultrasound is sufficient if done by a trained expert. Sometimes MRI may be needed as well. If you're dealing with shoulder pain, don't ignore it. Early diagnosis means faster recovery and better outcomes. If you found this helpful, like, subscribe, and share this video. For personalized care, visit chicagoarthritis.com. See you next time, and as always, live well.